Hey there, and welcome back to Kidney Cancer Unfiltered. I'm your host, Anna Maria Scaccia, and today we are talking about something that really makes a difference when you're facing kidney cancer: friendship. My guest today is Claudia Tatum, and she's going to share how her friends have shown up for her in ways she never imagined since her kidney cancer diagnosis. While friendship has always been important to her, she has noticed her circle stepping up in a whole new way. Claudia has also built strong connections with her clinical team, and we'll talk about how those relationships have helped shape her journey. So, grab a seat and join us as we discuss the people who make the toughest times just a little more bearable. Well, Claudia, welcome to the podcast. For our listeners who have not had the pleasure of meeting you, can you introduce yourself and tell us a little bit about your story?
Sure. Hey, Anna Maria. Yeah, Claudia Tatum here in the Tulsa, Oklahoma area. My background, my professional background, I'm a longtime oncology nurse and radiation therapist. So most of my oncology nursing was in radiation therapy. I am retired from full-time work as of February of 20, just before the COVID shut down. So I still do some PRN. I do a lot of volunteer work. I love working with the mission John 3:16 for the homeless. I enjoy an adult literacy program for adults who English is their second language. I enjoy that. I'm very involved with my church youth group. I got involved with the Kidney Cancer Association in 2023, January of 23. I was diagnosed with a chromophobe renal cell carcinoma. I had a radical nephrectomy. Margins were clear, all of that. So I was just on active surveillance
Hmm.
and I was clipping along really well with that for a little over a year, and we found out I had recurrent metastatic disease.
Ah,
Yeah, so here I am on Keytruda and Lenvima for almost 6 months now. I had a debulking, it's
okay.
abdominal metastatic disease. Some people don't know what the peritoneum is. And I had a debulking surgery the end of August and a hernia repair because I developed an incisional hernia from the nephrectomy. So, but yeah, I'm doing great. What was that? 3 months ago, and I'm doing well and clipping along with the treatment. And yeah, we'll just see what comes my way.
Well, I'm glad to hear you're doing well because that was going to be my follow-up question is how you're doing. Um, well, thank you for joining me, my fellow Chromie. Uh,
Romies.
As Chromie, speaking of fellows, where this episode is all dedicated to the power of friendship. And when we were thinking about friendships, you were the first person who came to mind, just because you're such a just lovely light, if that makes any sense. Like we met each other maybe a year or so ago via
Probably, yeah.
email, right? Like it wasn't anything. But you were just already right away, just so supportive and giving and there for people. So you're the first person came to mind. So very conversational. What has friendship meant to you through this journey?
Oh gosh, friendship has meant a lot to me my whole life. I've been divorced since 95. I have no children, so no grands. So consequently, the people around you, I don't live near my family, are your friends that are as dear as family kind of thing. But certainly, clipping along with this kidney cancer, I like to call mine an adventure. Everybody's on their journey. I call mine the adventure because it sounds a little more fun. But I think having had have a lifetime in oncology, if I hadn't learned that lesson that you better be grateful and enjoy every day, shame on me. But certainly, and it's been very helpful on this adventure that, my friends are medical and mostly medical in oncology. So when you work in the cancer where you're treated, oh my
Mm-hmm.
gosh, you know, it just makes a real tough situation so much more easy. I've got access. My very dearest friends are the physician's assistant. I handpicked my oncologist. So, and I see him anytime I go in. I try not to take advantage of that relationship by any means. The social workers, the licensed clinical social workers. I handpicked my navigator who doesn't even navigate the GU tumors, but right when I was diagnosed and I had gone up, it's like, oh my gosh, what am I going to do here? I need a navigator. So I said, who does the kidney tumors? And it was one of the nurses that was off that day. And she goes, well, I'm glad to be your navigator. So it's like, okay, there you go. I'm setting my support team
Yeah.
up right from the get-go. So yes, friendship means a lot. Yes.
So I guess when you first found out about your diagnosis, like who did you, of your friends group, like who did you turn to? Like how did you turn to them and how do they show up for you?
Well, I was quite the open book, and I had decided from the get-go, having lived alone, and, I'm pretty proud of my independence and my self-sufficiency. But it's like, okay, I know people are going to want to do for me. So I've got, to have open hands and an open heart to all of that too. So, as I said, I went up and picked out my navigator and, ran over and started talking to the PAs and started even talking to the administrators. I was quite the open book because if you can't count on your oncology team who have become my family, it's like, oh my gosh. But outside of my work and my relationships at the cancer center, you start calling your besties. Hey, you're just not going to believe this. I just had an incidental finding of a 12-centimeter mass on my kidney. So, I called my dearest of dear friends. I didn't, I don't put stuff on social media or anything. I like a lot of stuff and I get tagged in a lot of stuff while I am an open book, I'm not that public about it. And
Yeah.
then, trying to figure out how to tell your family, that was a real challenge. But yeah, my, dearest of dear friends, which, there's probably, a small handful of them, just letting them know. And they were, whatever we can do, whatever we can do. It's like, well, I'm getting ready to have a big nephrectomy in 2 weeks. We want to come out. We want to come out. But by then, my friends at the cancer center had already decided, okay, this nurse, Tammy is going to stay on this night and Becky's going to stay on this night while you're in the hospital. And my PA friend, came when I got home and stayed with me, the weekend and all of that. So they were making plans for me that I didn't even have to make. They were all just stepping up and doing what needs to be done because they're oncology medical professionals and they know what the needs are.
That makes me think. One thing that we often talk about, obviously, when we talk about cancer, is like our immediate caregivers, right? Like the person who's right there for us, who's helping us, taking care of us. But we never really talk about, which is why this episode came up, the impact on our friends, right? Like, and the fact that you had these friends already making these decisions for you because they knew what you needed
Mm-hmm.
trying to be there for you. What do you think it's like? Or rather from your perspective, like what us as survivors, what do we need to know about how our adventure, our journey is impacting the friends around us? Like, what kind of, yeah, I'm not sure where the question is in that, but it's something that just made me think, like we think about caregivers so often, but we never talk about, what it does to our friends.
Well, yeah, and I see where you're going with this too. So just knowing that, not all my friends are oncology medical professionals or even any kind of medical profession. And we know so many people have a negative perception and a lot of fear around the big C and that kind of thing, and people don't know what they don't know. So, and I think that's how people get away from, trying to offer some help. They don't know what to do and they're scared, and when you're scared, you get that fight or flight, and not everyone can fight.
Yeah.
So they just kind of get away because, maybe they saw their parent or whatever, their spouse die of a cancer and it was so horrible. And now Claudia's got this, and oh, poor Claudia, and all of this. So yeah, people are just reluctant, I think, because of their past experience and their knowledge base, not to get too involved. It's like it's just too hard, and especially when you think about, oh my, especially when I, had, when my status from no evidence of disease switched to metastatic recurrent disease, it's like, oh my God, Claudia's going to die and this is just so bad. And, we just can't deal with that. But
Yeah.
because I've evolved such close friendships along the way, you know who's invested in you and, they're going to be with you right there till the end. So.
But just the idea of like, what can we do though as survivors, like who are also reluctant to turn to our friends for whatever reason it might be?
And telling people what you need and what you don't need. That's what I've been doing a lot of too, telling people, okay, whoa, stop with that. And, some of the folks that aren't your dearest of dear friends and they call and they say, well, what's metastatic disease? What's peritoneal carcinomatosis? It's like you get tired of saying that stuff over and over. It's like, which, I know better than to lean too much on Dr. Google, but for
Yeah.
definitions and stuff, why don't you look it up a little before you ask me to keep saying that again and again and again.
But you bring up a good point about communication, right? Like again, we talk about that as our relationships with our caregivers, like making sure we're communicating with them, telling them our needs. When it comes to friends and friendships, what do you think that communication looks like? You brought up a good point about having them like kind of do their homework before they start peppering you with all the questions about your disease, which I think is just true of anybody in your life, right? Like just
yes,
or any
yes.
situation that you're going through. Um, but what are other ways in which like we need to communicate to our friends about what we're going through and kind of just setting boundaries or being open to them, if you will?
Well, here's an example kind of that I like humor. I think laughter therapy is so important in our lives, and certainly when you've got, a diagnosis of cancer. And I know when I was, it's even around my medical friends at the cancer center, and they'll be talking about something that's next year or 6 months or whatever. It's like, well, yeah, I think I'll be around then, or I hope I'm around. And they go, oh no, Claudia, don't say that. Don't say that. You're going to have a long life. And it's like, I believe in giving hope, but that's a bit of an unrealistic hope right there. But we never know. We don't
Yeah.
know. So, and that's what I've had to tell people. It's like, okay, when I say, and my friend that was the absolute best with this is a retired uh, OR trauma nurse, for a long, long time. And she's the gal that came down and stayed with me for 2 weeks when I had the debulking palliative abdominal surgery. And, I'd say stupid stuff like that. And she would just laugh. It's like, that's it. I'm just trying to have a little levity. So laugh with me. I'm not looking for some empathy or sympathy. I'm not looking for you to say that unrealistic hope. Let's just laugh about it. Yeah, you wake up and I walk into the room sometimes and I go, I'm still alive. I'm still here for folks you hadn't seen in a while. And okay, yeah, y'all just laugh
Yeah.
with me kind of thing. And then, putting the boundaries, on people, it's like, you know, I don't want to know that you feel badly for me, because maybe you don't get it. But yet again, I don't want you asking me too often, and these are my non-medical people, about what is my prognosis? It's like,
Yeah.
if you look it up with Dr. Google, it does not look good.
Yeah.
But it's like, okay, yet again, we all know when we know anything about statistics, most people live this long, but you got the folks that lived less than that, and you've got the folks that lived before that, which kind of goes back to, the incredible support groups I found online that, there's people living, 3, 4, 5, 6, 7, years with metastatic disease.
Mm-hmm.
So, I want to be in that group that does well, but I don't really want to talk about it
Yeah.
prognostically. Let's just stay right where we are. And you mentioned talking to your therapist. Oh my gosh. I got back reconnected with the therapist again, because even though my friends are very therapeutic in the cancer center, you want that third party, that non-biased person to say, Claudia, come on, get over yourself, move on, or whatever it is. And I remember having that conversation with my oncologist because I can overthink things. Imagine that, right? So I'll, be telling him stuff. It's like, whatever, whatever, whatever. I said, but, I might just be overthinking this. And he'll say, you're overthinking this. It's like, okay, thank you. Thank you for giving me that perspective and putting me back in my seat because, those of us that enjoy controlling things in our lives and we work very hard at that, and which goes back to that independence,
Mm-hmm.
and self-sufficiency. Okay, I've got a chronic disease here and I'm going to need some help with
Yeah.
people.
Yeah, that reminds me of this. I don't know if you've
Mhm.
seen it on Instagram or Facebook, but there's this meme that it's this woman carrying like a washing machine up like up train stairs, like up the subway station stairs. And it has some comment at the top of like wanting help, and then like me, this like hyper independent person, or something to the effect. And every time I see it, like I feel personally attacked here, because like you need help, but you're hyper independent. But you raise a lot of like good points, because I think when I first, or rather I know when I first shared my first diagnosis, even the second, like you get people who come out of the woodwork with all this like toxic positivity about you being okay, and like
Ooh,
grateful.
toxic positivity.
Yeah,
Yes.
and then you have friends who are just like, hey, I'm not even gonna try it with the pleasantries or like the platitudes. Like, this sucks and I'm sorry, right? Which is like, for me, it's like thank you. Like, you know me well enough to know that is what you need. But that brings up another point about seeing people come and go, right? Like, it seems like whenever there's like a tragedy of sorts, right? Let's call a diagnosis a tragedy, if you will. You have those people who come out of the woodworks who are there for you, and then all of a sudden, like a year later or so, they just kind of drop. Did you experience that when you first, like, I mean, not that you're necessarily talk a lot about it on social, but when you first shared your diagnosis, did you experience some of those kind of like fair weather friends, if you will, who came through and then just disappeared?
No. And maybe if they did, I just didn't notice it because I'm so blessed, with a wealth of friends. I
Yeah.
didn't notice it. I'm sure they were there, but I noticed, and I figured this out years ago, you need to pick and choose who you want there by your side as well. So if anything, I've had some friends that it's like I know I need to distance myself from them because of that toxic positivity or their chronic, overwhelming, amount of questions they come out with. It's like, mm-mm. So no, but yet again, I've lived a long time and I've figured a lot of things out, I believe. So, yeah, no, I think if anything, I've kind of weeded some of those people out, realizing they don't need to know everything. And yeah, I'm going to tell you, if they send a text or whatever, yeah, I'm good. I'm
Yeah.
not everybody wants to know that, yeah, you got this chronic fatigue and this muscle weakness and this hypertension and these headaches, all those side effects of treatment because I guess I'm going to have that the rest of my life.
Yeah. Yeah. And I think again that it goes back to that communication part of it too. And I think
Hmm.
as- we as survivors have that, I would say we have that right to be able to like guard ourselves and what are, because there's that other part of like that complicated friendship matrix, if maybe not matrix, that's not the right word, but like that complicated friendship thing, but we'll go with thing, where it's kind of like, do you owe it to your friends to tell them how you feel, and like, are they offended if you don't? And if they are offended, like, do they even have a right to be offended? And there's like, again, it's kind of the same things that you deal with like caregivers, but on a maybe not as intimate as of a level, because I mean with your caregiver, they're right there and they're like, it becomes more complicated. But I think with like friendships, what I've noticed over the last 4 years, it's just this weird thing of like, okay, who's using your cancer to get pity for themselves? Like, who's not,
Oh,
who's distancing themselves from you just because they don't want to hear, like, who's ghosted you because they don't want to hear about like your cancer's too much for them. And it's just really interesting, all of these dynamics that end up playing out when you have something as like uncomfortable, if you will, as cancer.
Uncomfortable, yes.
Yeah. So it's very interesting. And I know I keep doing the parallel to caregivers, but like with a caregiver, it's very like intimate, one kind of dynamic experience that ends up being maybe, complicated or layered. But then with like friendships, you have all of these different types of like kind of dynamics to navigate. Again, the person who's like has toxic positivity down to like a science, the person who's just like real in there, and then the person who kind of the I don't know if you've heard this term, but the cancer muggle, who like kind of makes your cancer about them somehow, and then like the people who kind of like just ghost you and kind of shy away. And so what would be your advice? Because I know you have a very like strong support circle, but I'm sure
Hmm.
experience some of these dynamics. What would be your advice then to survivors in terms of navigating these different types of friendships? And I know we mentioned communication, but what are some other things that we can do to maintain those strong friendships and basically rid ourselves, if you will, of those that are a bit toxic and not good for our health?
Yeah, yeah. Well, paying attention to the conversations you have, because generally speaking, I don't think it takes too long to figure out the folks that are, engaged in your situation and have sincere, true wishes and needs to support you, as opposed to the others that, oh, well, I had, GYN cancer so many years ago that, they're focused a lot more on them, which so much of that is human nature. It's kind of hard to change that, but certainly picking and choosing those people which goes back to what I said earlier about prioritizing your friends. You want to be around those people, regardless if you have a cancer diagnosis or anything, that bring you joy, that
Yes.
elevate you, that make you a better person, that makes your day better, and all of that. And that kind of goes back to, part of my wanting to contribute and give back after I had this diagnosis. It's like, okay, well, maybe I can help some of these people, and we talk about this sometimes too, being that poster child for living with stage 4 kidney cancer, and trying to help people with awareness and being
Mhm.
attuned to your own body, and driving home that principle of communication, talk to these people, your friends, your family, and try to keep them in the loop, and
Mhm.
maybe, do something that will help them, but yet protecting yourself. It's like, okay, you don't bring me any joy, you bring me down. So, I'm just going to try to distance myself a little bit from you. But that
Yeah.
doesn't mean I'm going to totally ghost you necessarily, but I'm going to limit my discussions with you.
Yeah, and I think communication goes both ways too. I don't think that,
Hmm.
you know, I think it's perfectly right and fair for our friends to say, like, hey, honestly, I'm going, like, I had a friend when when I shared my second diagnosis, she reached out to me. She's like, Anna Maria, I am thinking about you and I'm sending you all the love, but right now I'm like going through too much in my life that I can't be there
Mm.
as a support. But just know that I am thinking about you and and I hope you're going to be great. And I was like, thank you for that. Because it's such a simple message. I do not have any ill will towards her because she can't be a support for me right now, because people do have their own lives, right? But just being able to tell that, a survivor, like, hey, I cannot, like, I do not have the emotional wherewithal to be there for someone else because I'm trying to like keep myself together,
Hmm.
but you're still in my thoughts and I still love you. For me, that has gone a long way. And not even just related to cancer. Like, there are friends that I've had conversations like that with, like, hey, I have way too much anxiety and depression to maintain our friendship, but just know I like think about you and I miss you. And I'm like, hey, I get it, because I like do the same thing too. And you are always in my heart. Um, what can we do, right, as survivors and friends, to make it more comfortable for our friends to be that honest?
That. I love that. And I think I have a little example. A longtime friend of mine that's an oncology social worker. She's been my healthcare proxy for a long time. And now that my health status has changed, I relieved her of those responsibilities. She had two new premature grandchildren. She has a total of, gosh, like 6 or 7 grandkids now. And she just has a lot going on in her life. And I said, okay, I'm going to change my healthcare proxy now.
Mm.
Thank you for serving me so well, but I know you have so much going on in your life, you know, and my status has changed. I'm going to make some changes in my legal business so that you don't need to feel like you have to do this for me. And of course, she laughed about it and said, "Oh, you're firing me." It's like, well, if you want to call it that, I guess I kind of am, but I appreciate your service. And she
Yeah.
just didn't want to tell me. So sometimes we have to make that first effort to let some people go that we know can
Yeah.
be overwhelmed with their own life.
Yeah. And it doesn't mean that the friendship ends, right? It doesn't have to mean that
No, not at all.
ends
Not at
or that
all.
it changes at all. It just, there's one thing I teach my son often, right? Because he's 9 and he's growing and he's finding himself and he's finding friends. And we talk about friends a lot. And like, there are two things like I try to teach him. One, you don't have to be liked, right? Like, you do not have to be liked by everyone. So
Mm-hmm.
not try to force yourself to be liked by people, right? Because then you lose your authentic self. And then the other thing is like, there, everybody has a reason, right? Like, not every friend in your life is going to be the same for you, right? Like, there's not
Mm-hmm.
gonna be a
Mm-hmm.
purpose to them. Like, even relationships and friendships and jobs and whatnot, all these like connections and partnerships and relationships that we have, they all serve different purposes, right? And it's you have to find what purpose that friend serves for you. And maybe there's a friend in your life who's not the one who's going to be the person that you talk cancer with, but they're going to be there when you're like sad, and they're going to find a way to like make you happy and joyous and laugh. And I think that's
Uh-huh.
right. Like, that's okay for friends to have different purposes in your life.
Absolutely. And good parenting there. I think the
Yeah.
sooner we learn the relationship plans and so many things, and about being flexible so we don't break, when we learn
Yeah.
those things early on, you're much better going into adulthood.
Yeah.
Good job.
Well, thank you. I mean, it took a lot of trial and error and trauma for me to figure that out for him, but I see him growing, and it's like, hey, like, all those things I wasted my energy on trying to do. Like, I want him to be able to like grow up already, like, kind of whole in that sense of like, I'm gonna be in touch with myself and not like, because you can not collect people just for the sake of collecting people, right? Like, you see that and it's like, how big is your social circle? And it's like, sometimes it's not about the quality, right? It's about not the quantity, it's about the quality. And that's what I'm trying to teach them. But I think that applies here too, right? When it comes to friendships while we're navigating cancer, is like, what are the quality of the friendships that you have? And like, what are they serving you? I guess for me, I've had a couple of people ghost me, and it's like, I get it. Maybe me being, about cancer was too much, and I get that. But again, going back to the communications, like, just tell me, just like say, hey, like, this is not how I can be your friend anymore. Like, I need to take a step back. And I'd be like, okay, that makes sense. I'm sorry that like that consumed you. I'm sorry. Like, um, and yeah, I guess my question for you then, or like just getting, your opinion on this is like, how do we make it comfortable, or what can we do better as survivors? Maybe better is not the right word, but like, what can we do as survivors to just make it comfortable for our friends to just, if they have to take a step back, take a step back. If they want to, be there more for us, be there more for us. Like, other than communications, what are some other things that we can do?
Well, when we are speaking with them, being, as we're speaking here as, chromies, it's like they need to see us being comfortable with our own diagnosis. Because if I'm going, oh my God, I don't know if I'm going to live long enough for this event next year or whatever, oh my God, then they're going to get that, oh my God, that's not good. So being comfortable ourselves, which that's a challenge
Yeah.
too. That I'm making that sound like it's easy. It's simple, but it's not easy all the time. Just, so that they hear us talking about it and being hopeful and optimistic, and that they see us tapping into our resources and accepting their help. They're going to feel better about this too. And a lot of times, this friend I saw just a couple of weeks ago when we met up in Kentucky, she hadn't physically seen me,
Mm,
and you can have conversations with people. I'm of that generation. We don't do a lot of FaceTiming. Um, it's like she goes, "Oh my God, I'm just so happy to see you and put my arms around you. And, you look terrific and you are terrific." And it's like, I am, I'm still Claude, I'm still the same person I was, and we're going to go and have a good time, but yeah, I've got advanced cancer. It is what it is, and I'm going to work with it, and I want you to work with it too. So, you laugh and you cry together, all
yeah.
of that.
Yeah, you just don't want to be treated differently because there's no, I mean, not
Yes,
that your life isn't different, right? And there are going to be certain aspects that are different about it that you have to kind of be flexible and not bend, like pivot and not break. But again, it's still being treated as a whole person, right? Because
right.
then it's like you become it kind of forces you then to become so consumed by your own cancer too, right? If
Oh, yeah, yeah.
people around you like treating you as just your cancer diagnosis, then it kind of forces you to just be your cancer diagnosis because it's like, then who else are you? You know what I'm saying? Like, who else are
Uh-huh.
you when you
Yeah,
have
yeah,
all
I hear that. Yeah.
you has? But the other thing I want to touch on is new friendships after a cancer diagnosis, right? Like, so we're talking about the friends that we already had, but tell me about some new friendships that had come about after your diagnosis. Like, what did your friend circle look like after it?
Oh, yeah, I love talking about that too. And because, even though, my closeness and the enrichedness I've gotten from my longtime friends has grown and improved, the people I've met, I mentioned to you that, I've got three tremendous Facebook groups that I'm involved with, so, and many of these
Yes.
people. It's been a
Yeah.
delight getting to know you and being in the same boat as someone else.
Mm-hmm.
There's nothing like, okay, we're both paddling and we're both trying to be the best we can be and overcome these obstacles and these challenges we have every day. I've met other chromies that, have peritoneal disease, and I see how well they're doing and they're on the same treatment plan I am. You can pick up the phone and call or text any of these people you've only known a very short period of time, and even a short period of time you've never met in person. And I don't know if I can name any names, but your BFF Tracy has been awesome, and Linda
Yeah.
and Joel and, Caroline, anyway, it's just for people that you've never even met. And I've met a couple of people,
Mm-hmm.
that are renal cell survivors in Oklahoma. There's something about somebody that's just 100 miles away.
Mm-hmm.
I don't know. It's restoring. It's uplifting that we all share that commonality. It's been terrific how simple and how quickly you can get to know people just through a diagnosis.
Yeah. Because there's just something about them knowing without you having to say, right? And like
Oh
it's
yeah, yes.
that's a conversation I have with my partner all the time about like when me talking about my cancer to people. I'm like, there's just, if it's cancer related, more than likely my group of survivor friends that I have, like that close knit group, is probably going to find out first before I even tell anyone else because
Yes.
there's and it's not to say our friendships are just around like our cancers and our cancer trauma, right? Like we share other things with each other, but there's just something about them knowing and understanding without you having to say more than like, here's this thing. And it's like, then they'll just automatically know what
Yeah.
you're feeling.
And particularly, with renal cell carcinoma, oh my gosh, I know a lot of people with breast cancer, a lot of people with colorectal cancer, but I don't know many people except since my own diagnosis, other than patients, that kind of thing that I knew from the clinic. that have a renal cell carcinoma. And when you realize, you know what, so many of them, or most of them, were found incidentally, stuff snuck
Yeah.
up on us. We've had that shock of, oh, holy moly, and I love, the breast cancer world. I do a lot of work with those ladies, but, we didn't find a lump. We didn't have a lot of stuff that made us think early on, some vague symptoms. So about the time you start, I beat myself up a good bit early on. It's like, how did I grow a 12 centimeter
Yeah.
renal mass? Because I had vague symptoms and it was coming off of COVID. So we were
Yeah.
already having a lot of, do nothing kind of time. So yeah, I guess I had probably cancer related fatigue, but I didn't think anything of it because we weren't doing much. I had some vague GI discomfort. I had some low back pain that I was being treated. I had some physical therapy because I saw an orthopedic guy, so
Mhm.
I was doing some stuff proactively. But it's like, and then the next thing you know, when they incidentally find this big hunk of kidney cancer on a scan that they weren't even looking for that, it's like, oh my God, how could I have been so stupid? So then when you talk to other people and it's like, hey, they didn't pick up on theirs either, and they grew big kidney cancers or small kidney cancers or whatever. That was encouraging and supporting to me. So since then, I've given that up, beating myself up over that, which goes back to showing ourselves some grace.
Yes. Yeah.
Let's be kind to ourselves. Let's respect our bodies and, live in the moment and do the best we can. And what we were talking about earlier, I thought of another example because, I try not to get too emotional when I speak of this, but I did just recently join the palliative care team as a
Okay.
patient. I hear so many others talking about palliative care, palliative care. Well, those guys I worked in the palliative care department for a while. It's like, I think I'm going to sign up for that, which goes back to, utilizing all my resources and
Yeah.
being the best I can be, working with this diagnosis and this treatment. And one of the social workers said, it's okay, Claudia, that's what we're here for. We're going to listen to you. And if you lose it and bawl your eyes out, they encourage all that emotionality and all of that too. So that's been a real blessing too. With going back to my circle of friends, even though
Yeah.
their specifics is palliative care, they're still social workers.
Yeah.
They know what you need, what you're dealing with, and what you need to know and what you need to do.
And I think that's an important point because when it comes to like maintaining our friendships, and particularly the ones that we've had and developed before our cancer diagnosis, I think we also need to know as survivors that our friends aren't everything to us, right? They're not our social worker, they're not our therapist, they're not our
Yes, yes.
oncologist, and it's not fair to us unless it's like explicitly like shared between you, like, hey, you can trauma dump on me, like I accept that, for us to use our friends as that like one source of everything, because then that doesn't acknowledge their lives going on, right? Like it's finding that balance between being vulnerable and creating that connection with your friend, and also like respecting their boundaries and their lives and what's going on with them. So I think,
Hmm.
that's an important point of like making sure you're building up your resources too, because if you have those resources around you, then you know the people you need to turn to, and then you could show up more for your friends as a friend. So
Yes, nicely said, nicely
oh,
said. And that's it. Because so many people are reluctant. Well, like we were just talking about, we have therapists. Oh my
mhm,
gosh. And
yeah,
especially if you have, insurance benefits that covers that benefit, that's been tremendous. I actually have a couple of therapists. So, that's been very helpful too, having that third party, non-biased person, because our friends tend to go, oh, yeah, Claudia, you're right. Yeah, so much of this is real stinky, which a lot of it is. Oh, and that
yeah,
made me think this was one of the things early on, my little young 32-year-old youth pastor at church. Early on, she said, oh my God, I'm so mad at God right now. It's like, oh my gosh, it's like, I'm mad at God too. So she made that all right for
yes,
me to say that.
yeah, 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 and I think that's important. It's not just us, because I think we as survivors carry a lot of shame too. Sometimes I think you had
Oh, yeah.
we carry a lot of shame sometimes too, especially, and survivor's guilt. Like that's something I deal with a lot. And so I tend to be more of a closed book when it comes to like my relationship to my cancer, and things that I'm going through. Because like you can feel a lot of shame and a lot of guilt. And it's one of those like, well, I'm this, so like what right do I have to complain? So it's not just us making it comfortable for our friends to be able to be honest about like, okay, I don't have this to be able to be there for you, or this is what I can give you as a friend. But our friends being there and letting us know, I think that's the thing that we need, right? It's like our friends to let us know that it's okay for us to maybe not look a certain way or be a certain way or be that like warrior archetype that tends to be played
Oh, yeah.
for survivors, um the minute they get a cancer diagnosis, right? Like having our friends tell us like, hey, it is okay for you to be ugly, right? Like it is okay for you to be vulnerable, it is okay for you to be honest, it is okay for you to just like get angry and kick dirt, like whatever you need to say and need to do, it's okay, right? Like I feel like it
Hmm.
ends up going both ways in that way.
Oh, yeah, it's a tremendous opportunity for personal growth. Whether you're, a young person such as yourself or somebody that's 70 years old, you're never too old or too young to learn those things. And kind of like what you were talking about with your son,
Yeah,
teaching him all those things as an up and coming one day adult. I didn't have that
yeah.
growing up. That generation, we didn't talk about a whole lot of stuff. I remember my father had an inoperable lung cancer and lived 10 months. This was, oh gosh, in 1972, I think he died. And I remember one day asking mother, we were getting ready to go to church or somewhere. And I said, Mama, is daddy gonna die? And she just burst out into tears. It's like, okay, this is something we don't talk about. So,
Mm,
which goes
yeah.
back around to a lot of what we've talking about, that communication. You're never communication skills. And certainly when you have, a diagnosis of a chronic disease, or maybe even if it's not so chronic, a cancer diagnosis or anything, just being able to be a better communicator and understand your needs, and yet again, understand your dearest of dear friends and your caregivers and your partners' needs. How are we going to get through this? Which all that allows us for so much personal growth.
Yes, yeah. And I think it's okay for us to have those difficult conversations, right? Like it's easy,
Yes, yes.
what you were saying earlier in terms of people not maybe being comfortable. Like cancer is uncomfortable, right? And like it's
Yes, yes.
uncomfortable to
Uh-huh.
talk about and people don't know how to handle it. And I think even caregivers, it happens where it's like you don't want to think of your friend dying, you don't want to think of them not being okay who they are. But we need to have those difficult conversations
We do.
of growth, right? Like something amazing might end up coming out of having those difficult conversations and just again being honest. It just as someone with a good healthy amount of trauma in her life, I get the whole like people pleasing and compartmentalizing.
Mhm.
So I say this as someone, what I'm about to say, I say it as someone not who applies it to herself, but realizes the value in this. Um, but it's just being honest. Like honesty is just so important. Even with me telling my son, like, it's okay not to be liked. I've had that conversation with a couple of people, not necessarily friends, acquaintances, whatever. And they like always kind of do this, like, huh? Kind of thing. Like, it's like, why would you teach your son that? I'm like, because I want him to have a healthy life. Like, you're not always going to be like him. If he spends all of his energy being a people pleaser and making sure like he's not like ruffling feathers or he's not a burden or whatever because of something, then he's gonna have like a hard life. And I say this from experience. So it's like I'd rather him know. And it's like that honesty and that bluntness and that going, like you said, hey, I might not be here, being, blunt. It's not necessarily a way to like cause trouble or be like obstinate or whatever. It's just being honest. And like being honest is okay.
Honest. I
And that's,
love
I
it.
think, yeah. And I think that it just, again, it goes back to friendships too, right? Like just having those honest conversations or like being honest about like, hey, this is how this is how I handle it. And if you can't handle it, then maybe we don't be friends anymore. And even having that difficult conversation of, I think our friendship needs to end. Like, this is that you're not serving me in the way that is helpful to me. And, maybe this friendship does need to, like, maybe we need to part ways, and that's okay to do too.
And that's okay. That's okay. I love
So
that.
yeah, I mean, I don't know. I think it's just something like when you go through it, right? It's like hindsight is 2020 or whatever the saying.
Oh yeah.
Like, you go through it and you're like, hey, you think about it, it's like maybe it comes down to honesty and communication, and just respecting boundaries, like setting boundaries and respecting boundaries, and knowing that your friends, you can't be everything to everyone, and your friends can't be everything to you, and it's like, and then that's okay. But we are coming up to time, so before we let you go, I wanted to know if you had anything else to add. Like, maybe what is your one piece of advice? We talked a lot. I talked a lot. What would be your one piece of advice to our listeners?
No, it's been a delight. Like I said, you're just a jewel, and I just admire all your advocacy efforts, and
Thank
you continue
you.
to build on that. And that's what I want to do. We want to be those poster children for, living and thriving, as Joel would say,
Yeah.
with stage 4 kidney cancer or one kidney bodybuilders and all that. We want people to see and learn that, stage 4 cancer, stage anything cancer, but particularly 4 is not a death sentence. Let's don't be fearful. Let's learn as much as we can, because the lessons we learn now, guess what? They're probably going to be something we can use later in life.
Yeah.
And it's just all good. It's just all part of that plan. I am a faith-based person, and I believe things happen for a reason.
Hmm. I wish I could give you a hug.
Give me a
I
little
wish I could
virtual
give you
hug.
like
Yeah.
a virtual hug. But you,
I found this I found this quote. I was looking the other day. Difficult roads lead to beautiful destinations.
oh, that's such a good quote. It's such a that is a like a wall art quote right there.
We'll be on that. I'm
Say it
working
again.
on that. And
You
and
work.
McCartney and Lennon, I get by with a little help from my friends.
Yeah. It's friends are just so important. And I know I said we are coming up to time, but I just made you said something that just made me think um about another thing that I think is important for our friends to realize is that we are not them, right? And it's like they may
Ooh,
have a certain way in which they would go through a situation and approach a situation, but that does not mean that the person dealing with cancer would, right? Because you never know until you're in the situation. And
it's our own adventures, yes.
exactly. It's our own unique adventures. And you had said something basically about growing and stuff. And it's not just communicating, but being open. Like, being open to what your friend is going through and understanding that it is a lot, and they may not handle it your way. It doesn't mean they're not handling it the right way. And if you could
True,
be
true,
open
true.
to who they are and how they're navigating a not familiar, unfamiliar situation, then I think that also helps make the friendship stronger. But again, I really wish I could give you a big hug. I'm so glad, I'm so grateful that I met you. I mean, it's unfortunate that we had to meet each other over cancer, but I'm grateful for your friendship and your support. Your event last year for the 82K challenge for the Kidney Cancer Association 82K challenge, like I wish I was there. Like, I saw the photos and the videos, and I'm like, that just seems it seemed like such a wonderful, like, friend-filled, joyous event, because you bring so much joy to people. And thank
Well,
you.
look, I just cut you off. I
No, it's
apologize. You
okay.
are so
I'm
sweet, and
surprised I
right
haven't.
back at you, girl, with all those feelings. And you'll have another chance. March the 8th, Saturday, March the 8th, is the second annual Kidney Cancer Association 82K challenge. So we'll be doing our dancing and listening to fabulous music. So yeah, I hope it's even bigger and better than it was last year. So
I I believe it will be. But thank you so much for joining us.
Yeah, well, thank you for thinking of me. That you've said some
Sure.
lovely, kind things about me, and I appreciate that
I mean,
because as a new friend, I value our friendship as well. Crow me.
Romy. Thanks for listening to Kidney Cancer Unfiltered. If you found this episode helpful, be sure to like, share, and subscribe wherever you listen to your favorite podcast. For more resources and episodes, visit kidneycancer.org or follow Kidney Cancer Association on social media. Until next time, take care, and remember, you're not alone.